and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Welcome to Bristol Health Cares. We have an amazing episode here today for you. My name is Kurt Barwis. I'm your host. I'm the president and CEO of Bristol Health. Today we have Dr. Kazi. Dr. Kazi is a cardiologist at Bristol Health. Welcome, Dr. Kazi. Tell us about yourself.
It's such an honor and privilege to be here in this moment with you, and thank you to the station for inviting us. My name is Kazi. I am a cardiologist at the Bristol Health Medical Group. I'm honored to represent a group of cardiologists, 5 of them, who provide comprehensive cardiovascular care at the Bristol Health Medical Group and have operations in Bristol as well as other satellite towns, Plainville, Southington, and we cover that whole regional area, providing just every aspect of clinical cardiology, covering both outpatient and honored to provide coverage at the Bristol Hospital itself. And it's just incredibly exciting to be here with you.
Yeah. How long have you been here? How long have you been with us?
Well, Kurt, it's just like yesterday when I sat down to interview with you 14 years ago, almost 14 years ago.
Is it 14 years ago?
Oh, 14 years ago, you know.
Wow.
I was fresh out of fellowship at Hartford Hospital, where I did my clinical cardiology fellowship. I've been through and through in Connecticut, did all my training at the University of Connecticut, and then did my fellowship, specialty training at cardiology in Hartford Hospital, and just was very fortunate because right around that time, this is the year 2010, when I became aware of a highly respected group in Bristol, and they were fortunately looking for a position for a cardiologist at that time. And I was just blown away by just the talent of the healthcare providers in Bristol, and just the dedication of the board and the administration to quality and just to patients. The things that really drew me to the Bristol Health community was the concept of community care in an exceptionally integrated manner. And you know, obviously, I will say, based on my experience, I've seen that better than any other place I've ever been to, and I've rotated at all the big hospitals in Connecticut. But just the close coordination between primary care to specialty medicine, inpatient and outpatient transition is exceptional, and that's what I was looking for in a small footprint, serving the community at every level, and I found that.
Yeah, it's awesome, and you do a phenomenal job of it. Let me tell you, I'm just really proud to have you as part of our team, and our cardiology team is just extraordinary, as you said.
Just extremely fortunate to be part of that team. You know, it really takes a whole village to provide that care, right from our nurses, our technicians, our medical assistants, to our exceptional cardiologists, and all the people in the administration and the board. Yeah. It really takes a village to make it happen.
So what do you say to people, you know, so we don't have a cath lab, and we don't do open hearts, and we don't do some of these really, you know, what people would reserve for tertiary care teaching, big institution. Right. You know, how would you respond to somebody who's like, you know, says, well, Bristol Health doesn't have those things?
Well, you know, what's the reality is that if you look at the country at large, the large majority of care that is provided to patients is not in tertiary care hospital. It is at the level of the communities. And we're very fortunate to have an incredible network and a hospital already providing that for 100 years, and to provide a comprehensive set of clinical services in cardiology, whether it's coronary disease, arrhythmias, heart failure. These are the bread and butter of cardiovascular diagnosis that we come across locally, right here at the level of the community. And of course, we partner with our tertiary care hospitals for advanced procedures. The key thing now is early recognition and persistent prevention. If we can detect things early at the level of our primary care physicians, and then they refer to our cardiologists, we can diagnose and treat these conditions at a much earlier level, and also implement prevention at the same time. So I think that community model is extremely important. At the same time, we establish really close working relationships, referral relationship with our tertiary care partners.
Yeah.
And cardiology has seen, and I've been very fortunate to see at firsthand the development of modern medications, modern technologies, which are at breathtaking steps, going from the design phase into the implementation phase when it comes to amazing therapies, amazing procedures, which I was learning about in fellowship, and now I'm already implementing those technologies and those therapies in my patients now. It's quite amazing.
Yeah. And so heart health is, kind of I forget, was it last month was Heart Month?
Yes.
Or is it, yes, last month was Heart Month.
Well, yeah, the month of February is an incredible opportunity for cardiology providers all across the country to, along the themes of love and Valentine's and the heart, is to promote awareness and education. It's actually our busiest month for that reason. We have incredible opportunities. Just this year, we had a President's Forum where you were kind enough to invite us to talk to the community at Bristol Hospital, where our nurses did an incredible presentation on the cardiac services available at Bristol Hospital. Dr. Goslin, my colleague, did a fantastic presentation at the Bristol Senior Center. And we have so many other opportunities where we are invited to write articles that go out to the local newspapers. We do an amazing raffle. So these are the opportunities where we can spread the word about much of what's known as cardiovascular disease is preventable and treatable. And I think if we can translate that in simple language to our community members, it empowers them and their family members, and the word gets around.
Yeah, and as you said, being able to detect it early, being able to treat it, being able to help people with medications and other, medical advice and monitoring systems really can change the outcome for an individual dramatically by years.
Absolutely. It's truly life-saving if somebody can understand the value of say a life habit that they can implement and literally add decades to their life.
Yeah.
And the key thing is that communication, that translation of complex medical information into an understandable form and spread the message.
It's really that presentation you did was amazing. I had so many people come back and ask me about it and say we should actually record the whole presentation, and we should. What I find interesting is having gone back and re-looked at your presentation, all of this started. I mean, the awareness was like the 16th century, and unbelievably started with Da Vinci studying the heart and understanding the drawings, and they're still used today, is what I understand, in medical school.
I so appreciate that. Cardiology and its evolution parallels the evolution of medicine. It's mind-blowing that what I do every day, and I'm so fortunate to do, is built upon the shoulders of, thousands of, scientists and healthcare providers who share curiosity and the drive to help their fellow human beings, kept fighting through unbelievable challenges, when they didn't have all the tools and all the facts, but they kept digging and digging, and we went from not even having an understanding of how the circulatory system worked, going back to possibly medieval times. We were talking earlier about Da Vinci, and him as an artist, he had a deep appreciation of the human anatomy, but he was particularly curious about the human heart. And he said, how is it that this pulse that you feel on your wrist gets created, and how is it related to the pumping heart? And that led to this 20th century, where there was an explosion in discovery of electrocardiography, the use of ultrasound in cardiac diagnosis, cardiac catheterization. One study that comes to my mind is a European scientist and healthcare provider, Dr. Werner Forsman, who discovered cardiac catheterization by implementing it, experimenting it on himself. He literally was the first person to catheterize his own heart by inserting a urinary catheter through the arteries in his arm, and inserted it all the way until it reached into his heart, and then walked himself to the X-ray division and said, "X-ray my heart," and he did. That was the first cardiac catheterization.
That's unbelievable.
And he knew that he could have possibly killed himself in the process, but he wanted to know, because he wanted to figure out a mechanism to inject medications directly into the heart. So these people were almost, you could call them crazy, but they were driven by curiosity, innovation, and an empathy to help others.
Yeah.
And it's based on that now we're doing all the amazing things in cardiology. And now it's to the extent that now many of the cardiac procedures are being done minimally invasively, where, say, for example, the aortic valve, which sometimes gets tight and needs replacement. Previously, the only option was to do open heart surgery. But Dr. Henning, a Danish scientist, realized that, the stents that we use in our coronary vessels, we can make a valve out of this. So he started working in his workshop, and his efforts eventually led to the first transcatheter aortic valve replacement device, the TAVR device, which there's so many different types now, and now you can replace an aortic valve percutaneously. Mind-blowing, isn't it?
Yeah, it's
science
incredible.
fiction.
It is. I was watching a National Geographic show a couple weeks ago where they were excavating mummies in Egypt 2,600 years ago. And the average life expectancy back then was, in the early mid-30s, right? And they were actually taking x-rays and determining what kind of diseases that these individuals had. Right. At the time and what they were faced with. It was just extraordinary to think that today our average life expectancy is in the 80s. I think it's 82 or something like that. But
and that's the end result is improve quality of life and the longevity of life. We are slowly transitioning into a phase where molecular biology, genetics will eventually lead to treatment of these diseases to the point where, dare I say, we can cure many of the cardiovascular diseases. And I think cardiology in the next 30 years will look very different from what it looks like right now. Artificial intelligence will help us guide that. So these are incredibly exciting things to look forward to.
So for the person who's, an individual, what should they be thinking about in terms of their own health and monitoring their own health? What kind of signs and things should they, schedule an appointment with their cardiologist, their primary care physician? Hear a lot about people with high blood pressure, hypertension, those kind of things.
Yeah.
So for the average person, what should they be thinking about?
I think, in an age where we are utterly distracted by all sorts of notifications and signals, I think the key thing is to listen to their own bodies and pay attention to their own symptoms and not ignore them. So, the core cardiovascular symptoms are if anyone is experiencing any type of discomfort in their chest, if they are finding unusual shortness of breath with common tasks, racing of the heart, dizziness, these are core cardiovascular symptoms that one should not ignore and should report to their providers at the earliest available possibility, or listen to their loved ones if they say, I hear you're breathing a little funny, I feel that you're a little short of breath when you climb that flight of stairs and you didn't used to be. That's a sign.
Yeah.
Early recognition of that symptom, translating that to their healthcare providers could mean a huge difference. And then there are things that one does not have symptoms for that are incredibly important, such as checking their blood pressure, having their cholesterol screened. These things could literally save your life. And that is not anything, we talked about amazing innovations. This is something that one can do right in their own home. Now it's translating into consumer technology where you have these smartwatches, you have little mini home consumer EKG devices. So the technology is coming to you where it's providing you that sign that you're looking for. If your blood pressure is high or your heart is beating irregularly, report that to your doctors.
Yeah.
It's amazing.
It's almost, it's overwhelming at times to think about all the things that could affect you and how we in medicine and have evolved so much that we can help people so much. How about exercise? How important is exercise?
That's one of those things where we can talk about the most incredible, the most latest medications. What's fascinating is the preventative benefit of exercise to the cardiovascular system is beyond comparison. Just the simple fact that a person can stand up and put their weight on their hip and knee joints, that alone of getting up makes a huge difference in healthcare outcomes, reducing blood clots, improving circulation, improving your lung capacity. Taking a few steps. We're not even talking about athletic activity. We're talking about just getting out of your chair and walking around. So the power of physical activity is beyond compare, not just to our physical health, but also to our mental health. One could argue pound for pound, exercise is probably one of the best, therapies for mental health as well. But exercise, if you compare it to other therapies, pound for pound, it's superior. So it has a tremendous preventative benefit. And now, with modern, activity consumer devices, you can track that and create a secondary awareness of it. It's amazing.
I think it's so. If you're thinking about working out and doing exercise 3 times a week, 4 times a week, or just walking around every day. I see a lot of people walk now, which is incredible.
Absolutely. The American Heart Association recommends to do 75 minutes a week of brisk or moderate to high intensity exercise, or 150 minutes a week of low moderate exercise. It's hard in our everyday lives to always reproduce that, but I would like to, when I talk to patients, I say use the world as your gym and find little opportunities. Get up every few minutes, walk around, take the stairs, those kind of things.
I love that. Use the world as your gym.
Use the world as your
That's
gym.
That's a great. I may borrow that from you sometime.
All of that counts.
Yeah, it does. It really does. I get a lot of people get hung up on like how to get your heart rate to a certain level, and then if it's this level, it's too high, and all these like the treadmills and the ellipticals, they have these things on there that tell you, and then they talk about like if you're in this zone, that's where you're really like doing the best.
Yeah.
And is that real? I mean,
I think first and foremost, anybody before they start an exercise routine should consult with their healthcare provider to make sure that they don't have an actual contraindication to a certain type of exercise. But all that said, gradually as you condition your cardiovascular system, the sky is the limit. I mean, you can go to a certain level where you can push your resting heart rate down to almost a bradycardic level and achieve a certain amount of cardiac work with a lower heart rate. And therefore, little by little, you can condition and reach. I mean, I know you're an avid fan of exercise biking, and so as you continue training, I mean, you can push yourself to the upper echelons of athletic activity.
Yeah. Well, part of it is you've motivated me to do all that exercise because my calcium score was so high and cholesterol was so high. But it's, that's another thing that I hear all the time is, they take those statins and they don't feel good. They have muscular and I'm one of those people. I took statins and I had all the muscle pain and I couldn't work out. Yeah. So then you have to, like often happens, you have to make a choice, like which is more important? Is it the statins or is it working out? And then you came in with all this new medication and now I have no cholesterol anymore. But I still have to work out because what happens inside your body can cause you ultimately to have a problem.
Yeah, exercise not just is good to say lower your weight, lower your cholesterol, lower your hemoglobin A1C, but it is we know that exercise promotes just the basic cardiac physiology. It pushes circulation in a way that was not even possible before. So it has a universal effect on health. Yeah. Cholesterol is an elemental risk factor for cardiovascular disease. I mean, you heard about, heart disease runs in my family. Well, it really is high cholesterol ran in your family. And then you add other risk factors, and it's the perfect amalgam of risk factors that leads to heart disease or coronary disease. But cholesterol screening now for patients who have either proven heart disease or at higher risk of heart disease, we're recommending that their LDL cholesterol, which is the so-called bad cholesterol, should be as close to 70 or below as possible. Before it used to be a little bit higher.
Yeah.
Now we have modern medications, which is that you're familiar with, PCSK9 inhibitors, which are not statins. But for the larger population, statins are by and large safe and they're effective. So if somebody has high cholesterol, I think the healthcare providers will guide them towards a safe dose of statin therapy and watch them use it. And I think they will benefit from that.
Yeah. Dr. Kazi, thank you for being here today. This has been amazing, and I think we could probably spend another 3 hours even more talking about heart health, cardiac care, and it's just amazing to have you on our team. I'm absolutely thrilled to interact with you all the time and talk about these things, and it's great to share it with the public. Yeah. This has been an episode of Bristol Health Cares, and we're here for you. So if you have questions or you'd like to cover an area that's of interest to you, please email us, and we're happy to do that. I want to thank the Nutmeg TV staff and team here today. We've done a great job. Have a wonderful day and stay healthy.